During the first few days of August 2021, the US CDC announced the results of a new study that showed that people who are fully vaccinated and infected are just as likely to transmit the COVID-19 virus as those who were not.
Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission.
On other national media, Dr. Anthony Fauci also described a new CDC study and the change in its guidance based on its findings.
So it can be transmitted in a vaccinated person at the same rate as an unvaccinated.
You know, it is potentially, I want to clarify it for you because I do want to make sure there's no confusion. The level of virus in the nasopharynx of a person who's vaccinated and infected is the same level as the level of virus in the nasopharynx of an unvaccinated person. So you can make a reasonable assumption that they can be equivalent in how they transmit.
Just days after Fauci and Walensky spoke, Mills announced her mandate, justifying it by stating the opposite.
With this requirement, we're protecting healthcare workers, we're protecting their patients, including our most vulnerable people, and we're protecting our healthcare capacity.
If you have to go to the hospital or into a nursing home or your loved one does, you have the absolute right to expect that you will receive high-quality care and that you will be safe. That means healthcare workers taking care of you will be fully vaccinated against COVID-19 and other contagious diseases.
Again, the vaccines do not protect patients from infection.
But what they can't do anymore is prevent transmission.
Beyond the effectiveness of the vaccines, Maine had demonstrated no need to bolster the safety of its healthcare system. The week before Mills' announcement, Maine led the nation as the state with the lowest rate of COVID-19 infections among nursing home staff. In the 8 weeks leading up to her announcement, Maine lost one nursing home resident to COVID-19 every 2 weeks. In the 8 weeks after her announcement, Maine lost one nursing home resident to COVID-19 every 2 days. In the month leading up to the vaccine deadline, Maine lost another 29 nursing home residents to COVID-19. That's an average of one death every day.
A third protest in as many days against Maine's new vaccine mandate for healthcare workers. Dozens of people turned out in Augusta this morning to protest on the steps of the State House.
With lawsuits filed and protests statewide against her mandate, Mills used one of her last weekly radio addresses before the deadline to make a bizarre claim. Without naming anyone specifically, she said, "People have dishonestly claimed that Maine people would die as a result of requiring vaccinations for healthcare workers. That's an insult to every Maine person who has lost their life to COVID-19, especially those who contracted it from a healthcare worker who chose not to get vaccinated. First, it is not possible to be dishonest about something that hasn't happened yet. Secondly, as soon as she announced her mandate, the rate of deaths in Maine nursing homes went from lowest in the nation to highest. 2 weeks after her mandate took effect, after hundreds of workers had left the industry for good, Maine led the nation in the rate of COVID-19 deaths among nursing home residents. Statistically speaking, Mills' imaginary bogeyman was correct. More people died following her mandate than were dying before, and at a much higher rate.
We're protecting healthcare workers, we're protecting their patients, including our most vulnerable people.
Maine led the nation in the rate of COVID-19 deaths among nursing home residents.
And we're protecting our healthcare capacity.
Today, there are 6,614 beds in Maine nursing homes, but 1,607 of those remain vacant due to a lack of staff to care for the patients that might fill them.
And we're protecting our healthcare capacity.
1 in 4 nursing home beds in Maine sits idle while family members agonize about how they will care for their aging loved ones. Thanks to her mandate, Maine went from the lowest rate of infections among nursing home staff to the highest rate of deaths among residents. By January, hospitals were so desperate for workers, they allowed those who had an active, positive case of COVID to return to work while still infected.
Mary's hospital, that usually fills 100 beds, had 30 COVID patients and 70 staffers out of work. So they allowed 2 staffers who are COVID positive to come back to work.
When you can't staff properly to make sure that the patients that are currently in the facility are safe, that becomes a crisis staffing situation.
Despite the fact that this practice posed a far greater threat to patients than allowing non-vaccinated staff to work, the Mills administration took no action against the hospital. According to Mills' scientific approach, being unvaccinated but negative for COVID is a punishable offense, but going to work with an active COVID infection, that's just fine.